Hi, I'm Dr. Nathan Johns. I'm a rehabilitation physician from Melbourne, Australia, and I'm here today to tell you about a randomised controlled trial that I completed as part of my PhD studies with my supervision team. This trial was a pilot study with 60 people who participated in an online program called NEED, an unsupervised digital program to help people with persistent pain after knee replacement. We recruited people from online advertising through Meta from all across Australia, and in fact 43% of people were from rural, regional or remote regions of Australia. People were from 6 different states. There were more females included in the study than males. Participants were randomised to either complete an 8-week trial of the online NEED program or to continue with usual care. People who were having usual care were taking medication, seeing their GP, their surgeon, or having ongoing physiotherapy. (74% of participants agreed or strongly agreed that they were satisfied with the website. 67% reported that they would use it again. 74% of people agreed or strongly agreed that the NEED program had helped them with their health and wellness, and 73% agreed that it had been effective for helping them to improve their pain and improve their function. Because of the small group size and the nature of a pilot study, statistical significance was not looked for in the results. Between baseline and 8 weeks, the people who completed the NEED trial had a 1 out of 10 reduction in their pain on average, compared to 0.4 out of 10 for those in the usual care group. In regards to function, those in the usual care group improved their function over the 8 weeks by 0.8 out of 20, compared to 1.8 out of 20 for the NEED group. For quality of life, those in the usual care group had a decline in quality of life of 4 out of 100, compared to the NEED group, who experienced on average a 10 out of 100 improvement in their quality of life. Between the start of the trial and 8 weeks, 18% of the usual care group had experienced a 50% reduction in their pain scores. This compared to the NEED group, where 50% of people had experienced a 50% reduction in their pain scores. This was a similar result for self-ratings of global impression of change throughout the trial. 14% of people in the usual care group reported that they were much or very much improved over the 8 weeks, compared to 50% of people in the NEED group who reported that they were much or very much improved. In conclusion, we were able to recruit 60 older adult Australians to participate in an online rehabilitation program for people with persistent pain after their knee replacement. Participants in the program found the NEED website was useful and acceptable and would use it again. Participants in the NEED program also reported benefits in terms of reduced pain, improved function and improved quality of life. These clinical outcomes need to be tested in a larger trial to prove their clinical effectiveness. I want to thank my co-authors, my research assistant, Kalinda Randazzo, and also the 60 participants who took their time to participate in research.